Auzubillahi minash shaitanir rajim. Bismillahirrahmanirrahim. I am Dr. Shahzad Waseem, and in this small video and hopefully in the coming videos, I intend to talk to medical students who are learning eye and let them make it easy to make a conceptual image, as I always used to say, of ophthalmology from the point of view of attempting the paper, theory paper. And as we know, in Pakistan these days, the format of the paper is divided into two main parts. One is MCQs, in which there are four options, and you have to select the one correct option, and the STEM is scenario based. The question is scenario based, and you have four options, out of which you have to pick up the single best correct option. There is a possibility that more than one options can be correct, but the uh, better option, the best option, you have to pick. Similarly, the second part is SAQ, small answer questions. These are also scenario based, in which a small story of the patient is given to you, and usually three stems are given and two words are used. One is the name, second is the enlist. For example, name the diagnosis or enlist three differential diagnoses and list two treatment options. So by looking at this format, we come to know that the universities are trying to be as objective as possible. But to attempt these papers, you must have a concrete and conceptual knowledge of the subject. You can't attempt these questions with just hit and trial method. Only the correct answer will be picked up by a student who knows the subject correctly. So in this video, and I also keep in mind that large videos are not liked, but in some cases large videos have to be made. So trying to keep the balance, I will try to keep this video as short as possible. After telling you the basics of the theory paper, in this video I will present or discuss one of the scenarios which may come in your theory exams. So if we start from eyelids, and from examiner's perspective, if he is thinking about making an MCQ or an SCQ on a style, then the scenario would be something like this. A 25-year-old male presents in IOPD with complaint of painful right eye for the last few days. On examination, upper eyelid was reddish and a small swelling could be seen on torch examination, which was pointing outwards. This is the scenario, and if you know the style, then there are a lot of clues in it. The most important clue in this scenario is that the growth or the swelling is at the lid margin, and the more important clue is the swelling or growth is pointing outwards, and pain, redness, these all are the symptoms and signs of a patient with stye. So you not need to be and must not confuse it with Clesion, which is a painless condition. And as opposed to this particular scenario, the swelling points inwards. That is, it is seen on the eyelid but away from the lid margin, not at the lid margin. And when we avert the upper eyelid or the lower eyelid, we see the pointing end of the swelling, and the history goes back to a few weeks or months, and it is a painless condition. So regarding stye, the stems which are probably be asked will be: number one, name the diagnosis. So the diagnosis will be stye. Number two, name or enlist three treatment options which you will do. Number one, you will epilate the eyelash which is associated with the infected gland. As you know, I just told you that people, students with the actual knowledge will be able to pick. Stye is basically the infection of the glands of the eyelids, glands of Zeiss and Mole. No harm to remember the names particularly, but you must know that the glands of the which are located at the basis of the at the base of the eyelashes. So when you will see examine on the carefully on the torch, you will be able to find out which follicle is infected, folliculitis. You will epilate that eyelash. Number one, treatment option. Number two, you will give the patient the systemic antibiotics. Number three, as it is a condition in which the blood supply is being supplied from ophthalmic artery and basically and subsequently its branches, and systemic antibiotics, and number three, systemic analgesics also for at least 5 days. It will not only relieve the infection but also will cure the pain. Third option can be: what are the predisposing factors in recurrent cases of, not the word what will be used, name one most important predisposing factors in recurrent cases. So in this case, blepharitis, which is an inflammation of the lid margins, not the infection, is one of the most important predisposing factor in recurrent cases of sty. So you need to examine and check the blepharitis and treat it also accordingly. So this is a scenario about sty. I will stop here and hopefully, inshallah, in coming days, I will be trying to discuss with you people more scenarios, and I request all the students from anywhere, if they like this video or dislike this video, please comment, please comment in the box and let me know what they think about the content of this video. I openly want uh, an honest feedback so that I may be able to give you the required information and what you people want to know. What are the questions in your mind which you feel that they should be addressed at my level, at my minimum level of knowledge? I will try my level best to address those questions and waiting for your comments. Please subscribe to my channel and for now, Allah Hafiz. See you soon, inshallah.